And I wonder if I need to reach out to Commissioners Dance and Madsen and see if they're struggling this morning.
I would send them a text, yeah, if someone can. I don't have their numbers.
Okay, Mr. Chairman, we are live. I know we're struggling with a couple board members being able to get on, so if you'll give me just a moment, I was going to try to reach out to them.
Okay. While you're doing that, I think I'll just go ahead and get started. We'll have a roll call of those who are here. We do have a quorum, and so we'll begin the meeting just to get it underway. This is the February 4th meeting of the Eastern Idaho Public Health Board. We are grateful for all of the public who is able to be in the meeting with us on our YouTube channel or the room that's provided at the Eastern Idaho Public Health Building. Of course, I welcome all the board members and appreciate your attendance, as well as the staff from Eastern Idaho Public Health and administrators from some of our hospitals who will share a report with us later.
And manage this, I'll go to my other computer.
While we're waiting for other board members to come on, we'll go ahead and welcome those we have. We have our physician, Dr. Nelson.
Barbara Nelson here.
Thank you. And Madison County.
Commissioner Mendenhall here.
And we have Jefferson County.
Shane Young, present.
And Teton County.
Bill Lake, present.
And I'm Brian Reed from Bonneville County. And I hope to have some other board members joining with us. But as I said, we do have a quorum and we're going to proceed through. We have two sets of minutes from January 14th and from January 25th. They were provided to the board members, and of course they're on our
Scroll down.
our public health page, web page, for the public to view. Are there any corrections or changes that need to be made to those minutes? Hearing none, I'd entertain a motion to approve both.
Brent Mendenhall. I make a motion we approve both sets of minutes as outlined.
Shane Young, seconds.
Okay, thank you. We have a motion and a second to approve the minutes from both January 14th and January 25th. All in favor, say aye.
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 Is there anyone opposed? Okay, thank you. We'll go ahead and continue then with our reports from our regional healthcare partners. Dr. Gonzalez, I see we have you with us. We appreciate you being here and sharing a report with us. We'll go ahead and begin with you.
Good morning. Can you hear me okay?
We can, thank you.
Okay. It helps when you take yourself off of mute. So a couple things. One, from an inpatient and a treatment standpoint, we continue to see, we had about 5 days where we hit 0 inpatients for COVID last month. And we still have lower numbers at the hospital on an inpatient. I'm interested to hear from, I see David's on, but and he can give a pretty good regional perspective because he's been doing the regional call between 3 of our regions. So I'm teeing you up there, David. Anyways, I wanted to just point out what I know that others have brought up, and we should just continue to bring up. This week, for example, I know today we have 4 or 5 inpatients with COVID. The one this week that was our illest patient was 30, or is 32, excuse me. I shouldn't put that in past tense. And just a reminder of, there's such wonderful things going on, great measures, great trending, all of these things, but this disease is something that is still here, that we still continue to treat and continue as hospitals to prepare for you know, the unlikely, I want to just say that just because not from a fact, but just from a hope standpoint, if we ever had to surge up or certainly go back down. But I would say that the hospitals are all trying to figure out how to have this as a new norm, whether it's inpatient or outpatient on caring for patients with COVID. And I'm not saying that we're not going to get over the pandemic by that statement, certainly. And Jerry, David, others chime in if you're not comfortable in the direction I'm going in these comments. I'm just trying to really reiterate as we're going through all these positive measures of immunizations that we remember that this is probably a type of a disease that we will learn to treat on an ongoing basis unless Jerry pulls out her magic wand and she eradicates it. And I would be okay with that, Jerry. So you go for that. But again, just a reminder, we go from the excited helping with the vaccines and today, sorry, I had to think of the day of the week. Today, we will be giving the last of our, most of our employees their second doses. And so we're about 80%, I think I reported before, of compliance with the vaccines at the hospital at Madison. And those 80% will have received their second doses by the end of today. And then we'll continue on with vaccines, certainly from the employees, and then helping the health department and the public however we can with vaccinations. But that's such a wonderful thing, and the tears of joy and the excitement that we see through that process is a great thing. But just that friendly reminder to keep diligence and some great things that occur, but we do have a disease that we're still fighting. So I don't have anything else unless there's questions for me.
Any questions for Dr. Gonzalez? Well, thank you for that report, and thank you for the reminder of where we are and encouragement to continue to be as safe and diligent as we can going forward. We do have some additional board members that have joined us. We have Commissioner Madsen from Lehigh County. We welcome you, as well as Commissioner Shenton from Clark County and Commissioner Dance from Fremont County. So thank you, each of you, for being here with us. We'll go ahead and move on to Mr. Hoffenberg from the Eastern Idaho Regional Medical Center.
Good morning. Can you hear me?
Good morning. Yes.
Awesome. Well, I will start off by saying I agree with everything Rachel said. Numbers are looking better. Obviously, we are still seeing the most in terms of COVID in the region and the grander region. We are helping lead the calls with District 5, 6, and 7. So we are hearing more and more about what's going on down in Pocatello and Twin Falls. And it's kind of similar story at the bigger centers in each of those cities, that they're still getting the majority of the cases, but things are obviously lighter than they were just over a month and a half ago back in December. So right now we're sitting at 14 inpatients, 3 in our ICU. So that still means my ICU census is pretty high, but right now it's mostly not COVID, which is not how it had been in the last few months. So we are seeing patients from throughout the region, but for different issues. But we are still having some challenges with staffing. The majority of our needs are in our ICU and our PCU, so our step-down unit. But we've got plans to get everybody up to speed and hired. It's just, we just don't have enough at the moment, but we are getting that fixed pretty quickly. But, Rachel had mentioned that we are helping lead the group throughout District 5, 6, and 7. And just to kind of give you a sense for each of those areas, District 5, which is comprised of the communities of Rupert, Burley, Twin Falls, Sun Valley, that area, Jerome, so more central Idaho, outside of Magic Valley, St. Luke's Magic Valley, they're actually looking pretty good. They don't have much COVID right now, except in the Sun Valley area. I'm sure you've seen the reports that community is starting to see a large number of cases again. It's not necessarily translating to the hospital, which is good. So not sure if it's lower acuity cases or just not as severe, but they're not seeing it hit them that hard. District 6, which is Pocatello, Bear Lake, Blackfoot, just south of us, they are seeing inpatients in a few of their facilities, at Bingham and at Caribou and Port Neuf, but again, nothing that's been overwhelming to them. And so the sense around the state outside of our district is very similar to us. I mean, they're still seeing cases. The severity seems to be lower, and it's not at the overwhelming numbers. So as we just roll out our vaccines more and more, we're in our last dosing this week. As of yesterday, we had 95% of our employees and physicians that had consented to take the vaccines, taken their second dose. So we just have a few more folks who are either off schedule or just still need to come in. So by the end of this week, we hope to have everybody completed, and which is amazing news. And we're just excited to keep moving forward. But as Rachel said, make this part of our new norm. And we're actually creating plans to how do we more permanently create a separate area within our ER. We've had a COVID hallway that's been open, but it's been in kind of this limbo temporary kind of design where I'm asking my plan ops director, how do we do this for the foreseeable future? How do we make this more semi-permanent? So we're working with the fire marshal to see how do we make that a permanent space and make it a suitable treatment space for our patients. So we're coming up with plans, like Rachel said, to make this our new norm.
That's great. Well, thank you for that report. And yeah, we're so glad that all of these numbers are down. As I was looking at them, we're as low as we've been since early October. It's been quite some time. Is there any questions for Mr. Hoffenberg? Okay, well, thanks again for those reports, and thank you for all the medical community and what has been done to help treat the high incidence that we were seeing here just a short time ago, and that you continue to do now. So next on our agenda is our situational report. I'll turn the time over to you, Director Echow.
Thank you, Mr. Chairman. And before I go into that, may I please just read a quick update from Idaho Falls Community Hospital? Casey Jackman was not able to join us this morning, but he does report that Idaho Falls Community Hospital is also maintaining similar numbers in census as to what they saw during the spike. But like what you've heard from David just a minute ago is that it's not COVID patients. They only have one COVID patient. It's in the ICU on a ventilator, and the overall cases in their hospital have declined. Sorry, I got ahead of myself. They have 7 COVID patients total, 6 on med-surg floor, and 1 in the ICU. But again, maintaining high census numbers, but for other health conditions. Vaccinations continue with their staff and physicians, like you've heard from Dr. Gonzalez and David. And also they've been assisting School District 93 in doing the vaccinations for their teachers and staff and working to finalize those. And he said that daily operations there continue as normal with limited impact by COVID at this point. And if you remember early on, they had reported that they were able to get 2 ventilators on loan through Idaho Office of Emergency Management, and those have now been returned. So that's the end of his report.
All right, thank you.
I'll just pull up our data dashboard if you'll give me just a moment, and we'll review. Can you just confirm that you're able to see the dashboard?
Yes.
Okay, I'm going to have James go through the data review, please.
So as you can see, we'll just again start with yesterday's cases, kind of along the bottom here, an overview. We're now sitting at 22,235 total cases, with many of them being released. So 368 active cases across the district. 85 cases new yesterday. 26 of our residents hospitalized within our region. And we have sadly seen 206 deaths. Here, if you can go to page 3, the district level response. I want to highlight and maybe blow up that bottom right portion here. Yeah, we can slice it down to January, and then even that top right thing will, oh, it's covered up by the Zoom.
Sorry.
Should allow you to. So, well, I think that'll work just fine. So I want to show you here, just on our district level incident cases, that kind of a closer snapshot of what we're seeing recently. So you can see many of these dates, the very smallest numbers for the past few weeks were on Sunday. Thank you, Jerry. So 16 and 21. That made us decide to not include Sunday's data or report Sunday's data out, as we had continued to see very low numbers reported to us on Sunday. We just included those on Monday. So now you'll see a gap on Sundays that will start the week. But what I wanted to highlight here was kind of this bell curve, really, each week that we see. Mondays are normally a little slower as well, as nobody was tested over the weekend. And then you would increase from Tuesday to Thursday and then dip back down normally on Friday going into the weekend. And you can see that pattern or that wave, that curve continued really through January. And we're seeing fairly consistent numbers throughout that. I will just say that we're seeing slightly higher numbers this week than we were the previous 2 weeks on Tuesday and Wednesday of the previous 2 weeks. So something that's slightly concerning to us. I think the message from the hospitals is a good one. While we're very excited about the vaccine and these downward trends, we still need to kind of finish off this pandemic strong, get the vaccines out into everyone that would choose to have one, and be protected as much as possible as a society. So we can go over individual counties if you have questions, but that's a quick highlight that I wanted to just explain that curve and that trend that we're seeing. Again, through the week, we'll increase slightly and then dip down on the weekends, as not as many people are to access testing.
Any questions for James? All right, thank you, James.
So we're going to jump into the vaccination rollout, and this is the exciting news, the news that, or the process that certainly is challenging for everyone across our state and across our nation, but it is exciting times. So I want to first just start by saying that yesterday we had a press briefing to explain a change that Eastern Iowa Public Health is going to implement, or we did implement yesterday, to our vaccine scheduling process for the COVID-19 vaccine. On February 1st, seniors 65 and older were eligible to start receiving the vaccine in Idaho. And as we prepared for that, we had on Saturday opened up appointments throughout our health district for two weeks, clinics that were scheduled out for 2 weeks. Within 20 minutes, we had over 2,000 appointments scheduled. some people were able to schedule online, and we made it available by phone to call in as well for people that did not have the access on the computer. We very, very quickly realized that process was not going to be an effective way going forward for the target population that we're trying to serve right now. And so immediately on Saturday, we started brainstorming and pulled together, I would say in a very short amount of time, a completely revamped plan from what we had originally intended. I just want to acknowledge that we had a lot of confused, frustrated, anxious people on Saturday. And for that, I do sincerely apologize. That was not our desire. We were just simply trying to get appointments made available and scheduled. And so we've changed our process. So yesterday, we did announce that we will be taking a waiting list for individuals that want to get a vaccine from Eastern Idaho Public Health Clinics. And I will explain also that there are many other providers within our health district that also are getting vaccine and providing those vaccinations to their residents as well. But for anyone that wants to get on a waiting list for Eastern Idaho Public Health, and I want to show our website to maybe explain this a little bit better. So we set up a process that people can go onto our website. Right here on the front page and click on schedule a COVID-19 vaccine. People that are 65 and older, if they want to choose this option, simply click on this box right here that says adults 65 and older and just fill out a few simple fields that will register them on our website. What we're asking is for the county of residence, their name and their phone number, and the preference of how they would like us to contact them. Now, while 65 and older opened up on Monday, all the previous priority groups are still eligible to be vaccinated as well. And so if there's anyone in that group, they can just choose this other box and select which category they're in and submit the same information, their county name and their phone number. What we are going to do is on February 11th at 8 a.m., we will do a computerized random selection of names that are on our waiting list and put them in a priority order and start scheduling all of those individuals into clinics that EIPH will hold starting the week of February 15th and progressing out, I anticipate at least through the end of March, if not longer, until we actually get every single person that's on the waiting list scheduled for an appointment. Now that process will take us about 10 days to go through the list to fill a clinic. We know that some people that have registered will not necessarily need an appointment with us anymore because they've been able to secure the appointment somewhere else. And so we'll just have to work that list one clinic at a time. And so we'll fill up a clinic and then go to the next one, schedule those individuals. And our process will be that we will personally call every single one of those individuals to tell them of their appointment time and confirm the details with them. Again, trying to make it as simple as possible for our targeted senior population at this point in time. Now, I'll tell you what the app that we used, it did have some limitations that became very apparent as we tried to push it out to a larger population. But for other targeted populations, it has worked effectively for us. And an example is with our school teachers. Eastern Idaho Public Health did the vaccinations for School District 91, and it worked seamlessly, I would say, for that group. We were able to give it to the school district. They provided it to their teachers. They signed up. They were able to enter all of their information, and it worked very well. So I think at some point in the future, we will be able to reintroduce that as we serve different target populations. But it's put on hold for right now for our senior population that we're assisting at this time. I would also say that we're starting this process on a transition basis today. And this it goes into the opportunity that we've had this week to receive some extra vaccine that we had not anticipated. I'm going to talk a little bit about some of that, but before I do, I would like to ask if anyone has questions about the new scheduling process that we implemented yesterday.
Are there questions from board members?
Yes, this is Commissioner Mattson.
Go ahead.
We had seen on there, and I just had a couple of people ask. They signed up their name and whatnot, and I did my dad's too, and we didn't receive anything back. Is there going to be? They just kind of have to just wait for that text or phone call?
So as you can see right here, and I'll just explain this, we had, sorry, I'm looking for it on here. And I'm not right here, sorry. We had, that's a good question, Commissioner Mattson. And I will just explain that before this week, and probably for the last month, we've had, as you can imagine, an enormous amount of calls coming into our office for people asking when they can get a shot. And we weren't able to tell them a definite date. And so what we had committed to was giving people an option to sign up to receive a notification that we would let them know when their priority group was open and they could begin scheduling appointments. That's what we did on Thursday night for about 11,000 people that had previously signed up on that notification list. So anyone that's already scheduled up on that list, yesterday, sometime from 10:30 until maybe early afternoon, a notice went out to every single one of those people that had previously signed up saying, we just want to confirm that you are on our waiting list and there's nothing else that you have to do at this point. If people signed up after those notifications went out, if you sign up online, you simply get the message on the screen that says, thank you, your form has been submitted. If they called on the phone and we entered them into there, there's nothing they would get at that point. So the process now is, as soon as we have an appointment for you, we will call you and tell you what that appointment date and time is. So I hope that answers that. You wouldn't have necessarily got a confirmation if you signed up sometime yesterday.
Okay, thank you.
And I will share that it did cause a little confusion yesterday as well, right? Because we already had people scheduled into clinics for next week. So when they got the confirmation that they were in our system, we did have a lot of people call and say, well, if I already have my appointment next week, does that change that? And the answer is no. Anyone that has a confirmed appointment that they were able to make last Saturday for this week or next, those appointments are still in place and nothing changes with those. Now, going forward, we'll be able to deduplicate that notification list. So if someone has been served by Eastern Isle Public Health at one of our clinics, we're working very hard to get that data entered into our system as quickly as possible. So then we can deduplicate that list of people that need appointment going forward. So that's what I mentioned. We'll be working that appointment list every single day, cleaning people out that have already received a vaccination from us, so that we're not reaching out to them again when they've already been served. So it is a work in process. We're testing it out today, like I said. And on that note, I had mentioned that we had received some extra vaccine, and we've talked about in the past about the Federal Pharmacy Partnership for Long-Term Care Facilities. And in our region, we had, I would say the majority of our long-term care facilities had signed up with CVS or Walgreens to have them come into their facilities and vaccinate their residents and staff. That program struggled a little bit, and for CVS specifically, for the 3 facilities in our health district that were signed up with them, they were not able to perform that. And so we worked with other providers. We were able to serve one of the long-term care facilities, actually 2. And then another provider was able to do the 3rd one. Walgreens is my understanding that they have now been to every single one of the facilities that they had contracted with. But early on in the process, vaccine from Idaho's allocation was peeled off to send to the pharmacies that were enrolled in these long-term care partnerships. And I want to say to the tune of 45,000 doses of vaccine. We have in recent days and late last week, it was actually a week ago that we received notification that Idaho would be receiving back some of the allotment that had originally gone to CVS. And our health district was able to receive a flat of Pfizer vaccine. Now that has to be split between first and second doses. So that allowed us about 487 new individuals that we will be able to serve. And so we have clinics that are running throughout our entire health district. Salmon is a very good example. We did a joint effort in Lemhi County yesterday with Still Memorial Medical Center and Salmon Pharmacy. We originally had 150 doses to serve the community with that clinic. And because of this extra allocation, we were able to serve 400 individuals there yesterday. Teton County is another example. In that county, Teton Valley Health, Corner Drug, and Brolum's are doing a community-based clinic that is actually happening today. And they were originally allotted 80 doses and it bumped up to about 200. And so we appreciate the partners. As we say here, we have more vaccine to assist us in quickly being able to administer that to the public. For the other doses that we're receiving, we are today going to be scheduling people from Bonneville and Jefferson County into a clinic that will be held in Idaho Falls tomorrow. And then on Saturday, we'll have a mass clinic in Rexburg that will serve individuals from Madison and Fremont counties. Continuing on with the vaccine that went to the retail pharmacies, Walgreens also has excess vaccine that they're not using to do the long-term care centers. And that also is going to be coming back to Idaho for us to be able to use. And we don't know exactly when we'll receive that, but again, we anticipate receiving an additional 975 first doses for people. And so that will be added into the allocation for next week's clinics that will go not only to mass clinics that we at Eastern Iowa Public Health are doing, but extra allocation to all of the other providers that are enrolled. So it's a very fluid process. And when we get notification that we have more vaccine coming, we are working very quickly to get that out to providers so we can bump up the opportunities for people to get that vaccine very quickly. Are there any questions about that?
Let me just interject first, and then board I welcome your questions. Jerry, I really appreciate your sincerity in all of this, and it's obvious the desire that you want to make this as fluid and as easy as possible, especially for this group that we're vaccinating now. But I want the board to know, and certainly the public, the amount of planning that goes into this and the complexity of the whole system that they are working on. I was there last Saturday when they opened the phone lines at 9 o'clock because I wanted to see, and I, like all of them, was just so excited to start serving this part of the public. It was a great deal of excitement in the building that day. There was just, I don't know, there must have been 14, 15, 16 phone lines going, and each of them was just working so hard. Answering quickly, scheduling, and moving on to the next one. People running up and down the halls, moving lists around, and just keeping it going as best as possible. And just a great deal of excitement because everybody there was so happy to now be serving this next segment of our populace. After the 20 minutes and everything was filled, and I went away just so happy with what they had been able to accomplish, which was such an incredible feat to witness. And then all of a sudden, it became evident that with the 2,000 who received appointments, there were, I don't know, 16,000 or more that went away disappointed and frustrated. And as you said, Jerry, just with a lot of anxiety about what do we do. And so then is what happened is Jerry and her staff worked constantly through the weekend. She makes it sound quite simple. It wasn't. They were there late Saturday. They were there late Sunday night. Monday, we had a vaccine clinic and then worked throughout the day on the plan. I was there Tuesday until 6 o'clock, listening to them put the final plan on it. And I was just amazed at the level of detail and care that was given to make sure that this rolled out in a better way this time, and that it would be able to serve all of those who were struggling with the system that they tried last week. I just think it needs to be said that this just doesn't happen without Director Radkow and her very talented staff, from crunching the numbers to putting all the database in to doing all the IT to answering the phones. It's just an incredible feat and comes with a lot of challenges. But I saw them just not care about any mountain too tall or any hill to climb. It was just, we'll take on whatever we have to do. We'll answer thousands of phone calls. We'll return thousands of calls. We'll do whatever it takes. We'll stay here as long as it takes to get this done. So, board, you need to know that. And Jerry, we just appreciate everything that you and your staff has done this week. It has been incredible. And for that matter, this year. So thank you very much from all of us. So let me open it up to any questions about where we're at right now on the vaccine from board members. All right, that sounds like we're understanding it, Jerry, so we'll let you continue. Thank you.
All right. I just want to say thank you. It just makes me very emotional because it is a lot goes on behind the scenes, and we are doing our very, very best to serve the public the best way for them. So thank you for that acknowledgement. I'm going to turn it over to Amy. Amy is our Clinical Services Division Administrator, and let her give some more information about the vaccination process.
Thank you, Commissioner Reed. Thanks, Jerry. I just want to give a couple vaccine updates on two vaccines that I've been watching to see when they're going to be coming to market. First, Johnson & Johnson, which is a single dose vaccine. Looks like they're going to be submitting their FDA approval, or at least to that VRBPAC committee, sometime mid-February. The numbers coming out for efficacy are lower, looking to be around 72%, but it still does bring an additional vaccine to the market. I don't know what that rollout will look like after it gets its approval. And then the other one we've been watching is AstraZeneca, which is also a 2-dose vaccine. It's been pushed back a little bit, so I don't think we'll see it submit for FDA emergency use until March or April. But again, that'll put a fourth vaccine into the US market at that point. And again, that comes with challenges as well. I'll talk about that in a little bit. Just even having two different vaccines in a clinic is challenging. But no, just our initial rollout, I was looking at numbers last night, through the health department clinics, we've now administered over 7,000 first and second doses. And even early on, compared to what we thought and planned for a pandemic, to set up those vaccine clinics, changed with the onsets of 6 feet isolation between people, and then even the 15 minutes waiting after a clinic. So even our early clinics here for healthcare workers, we had to change how we did that. We had to have spacing between everybody and space those appointments out. And then that's just carried over into our big clinics we've set up The one on Monday, we were able to administer over 700 vaccines during the day. And we have staff and volunteers that I think we can do double that, maybe even more. But just those limitations have been challenging to run those clinics. And we're trying to be creative as we are with everything else. We moved to, have people fill out paperwork in that particular clinic, just to reduce the number of people in the building as well. And actually that worked out really well, but I'm sure we'll continue to be creative as we do that.
Can I just say something?
Yeah.
She neglected to say that we had people fill out the paperwork in their cars, not inside the building, to give extra space inside the building.
Yes, sometimes my brain is faster than what I'm saying as well. But yeah, and so that did work. It required us to change, having, people outside to navigate that traffic flow, give them the paperwork, and then to make sure that paperwork came in the building with the individuals as well. And so I think we'll get better with that as we move through clinics in the future. And then, when first doses, same thing, looking at some of that, first doses at the end of day doses, we thought that was going to be some logistics, and it was. We very quickly created a waiting list at the end of the day within that same priority group that we were vaccinating, to be able to get individuals in at the end of a clinic if we had no shows to give those first doses. And now second doses have created some additional challenges as well. We have, here at the health department, I think we've done a great job trying to get vaccine out to partners and try and keep them with one vaccine or another. Here at the health department, we're able to be flexible and juggle both vaccines depending on what vaccine we have that week. But those second doses now, if somebody doesn't keep an appointment, for example, I have to make sure I'm trying to reschedule them on the day I'm doing second dose Pfizer or second dose Moderna. And then at the end of the day, when people don't show up, it now becomes a second dose that I have at the end of the day and not a first dose. And so now I'm looking at, who didn't show up for their second doses in the past few days and try and reach out to them. And, if we can't do that, then giving that second dose now as a first dose, and then assuring that I've had enough people not get a second dose to now make that second dose still have another second dose. And so as we continue to move through this, challenges continue to change. Logistics have been crazier, I think, than anything else I've ever been a part of. I've appreciated, Jerry's support as we work through that. Just an example, each night our clinic ends at 6 p.m. here in the Idaho Falls office, and we could be here as late as 8 o'clock at night, just trying to make sure that every single one of those doses we have are given to the right people, to get them in. And so it's been challenging, been very challenging, very excited though, as we move through the 65 plus, those people that, we are able to get into those clinics, like Jerry said, it's just been emotional, it's been rewarding. And our staff has been just, they're excited to be part of them. It's been a long 10 months, and it's been rewarding now. These last several days have been rewarding for them. Do you want me to talk about anything else? Oh, I think Jerry's going to show the dashboard.
So we've talked about this at our last meeting, that this is the dashboard that's hosted on the coronavirus.idaho.gov website. And 10 days or so ago, Governor Little signed an executive order that will stand up a more robust website here and a vaccine accountability. And so it's supposed to be launched on Monday, and it will include data on every single provider in our state that has received COVID-19 vaccine. It will show the amount of vaccine that they have received, how much they've administered. And so the goal is to assure transparency with the public, that vaccine is being administered as quickly as possible in our state, and that there's not vaccine just sitting in freezers or fridges somewhere that it's going unused. Right now, it's not broken out by county. It's only simply broken out by health district. And so you can see total, we've given 12,000 doses. But for Eastern Idaho Public Health's 8-county region, this includes all providers. over nearly 9,500 first doses have been administered. And then people that have received both doses is nearly 3,000. Now, I'll tell you that again, with this dashboard, it's not as simple as it seems because providers have 72 hours to enter the patient data into the Idaho immunization registry system, which is where they pull the data to populate this dashboard. And so there's a 3-day lag there. Another challenge that we see is that as vaccine comes into us, and so I'm going to give you one perfect example of this. The extra tray of Pfizer that we received this week has to be used for first and second doses. And so while we're going to administer almost 500 of those doses in the next couple of days, the other 500 will be sitting in our freezer for 3 weeks because we have to reserve those second doses from that vaccine. So again, there's a lot of intricacies, and it's just not as simple as it would seem. But on Monday, you'll be able to see the new dashboard unveiled here. We have been working very hard with the state to make sure the data is as clean as possible. But we'll see that launched on Monday. I want to just give James an opportunity while her crew are on the front line and doing the administration piece. James Corbett, our clinical services division administrator, and his health preparedness team is on the behind the scenes helping with all the logistics and everything else. So I just wanted to give him an opportunity if he wants to share.
Yeah, so certainly as both Jerry and Amy have mentioned, the logistical challenges of making sure that this vaccine goes out correctly and timely have been difficult, but the team has tried very hard to make sure that we're getting vaccine out equitably to all counties. And so hence we're hoping to make sure that gets out equitably to individuals within those counties. Providers have been a great deal of help to us in helping that. There was a very few providers early on in this, mostly hospitals, and getting that vaccine out to their staff. As we moved into some of the larger groups, they did a great job of partnering with us to help get out to the schools. We had many partners, including Brolams and Madison Memorial Hospital, Albertsons, Mountain View Hospital, and more, Steel Memorial, more to help us get all of those school teachers done in really a quick timeline. We were able to get those doses out really within 10 days to all school teachers, which is, I think, an amazing feat. As we continue to go forward, some of the challenges that we face from our end is to continue to give those doses out in an equitable fashion, as we've heard a little bit about Pfizer. Some of these large dose quantities and the timeline, once they are broken up, do create challenges with getting those out in a timely manner. I'll just give you kind of an example of what I'm speaking about. Pfizer, again, comes in 975 doses that have to be stored at ultra cold storage freezer. Once they're brought out of that ultra cold, they have to be given within 5 days at refrigerator temperature. So providers really have to have their A game to be ready to do that. So as we get those vaccines in and we allocate them and we communicate with providers that we have those doses ready for them, we then have to set up, delivery of that vaccine to many different providers, and then they have to give it in arms, and then they have 72 hours to get it into iris. So you can see that process can take a few days. It is not instantaneous from when the CDC may report it coming into our system, which is even days before we get it to that end of the row. So there's some challenges along the way. We're working through those as quickly as possible. Another challenge that I just maybe want to mention here for our own vaccine that we're giving, because we're essentially another provider helping in this fight as the immunization program. finding locations have proven to be difficult to do larger clinics at times. We certainly don't want to impact business or schools. Commonly use schools for mass vaccinations because their gymnasiums are great open areas to have mass clinics and to move individuals in a safe manner, maintaining physical distancing space through those sites. We've had agreements before with some larger facilities, but if it's not on a consistent basis, it's very hard to continue to move around your operation. So that not just for us hard to move around, but really for the public to understand where they need to go. It's much easier to have one location so that they start understanding where that location is. So sometimes what would work for a one-day event is not as easy to pull off multiple days a week or every week or every day consistently each week. Another challenge is just the second dose, as Amy mentioned. We do need to commit to that facility, 3 or 4 weeks later, depending on the vaccine, so that we can get that out. We're working through that. We've had leads on different facilities. We've been grateful for those partners that have offered up their facilities, and Idaho Falls, the waterfront is where we're utilizing right now. We appreciate that usage of that. Different locations across our district. The Lemhi County one yesterday used a Church of Jesus Christ of Latter-day Saint building there in that county to adequately do that. We were looking at that across our district to utilize some of those, as there's many of those within our district. However, due to some logistical or legal challenges, we're not going to be able to utilize those facilities moving forward. So again, we're just continuing to have issues that pop up, and we continue to work through those challenges to make sure that we can continue to give these as quickly and as efficiently as possible. So questions regarding any of that end?
Any questions? Well, thank you for everything you're doing, James. I know you and your team behind the scenes have just been incredible. So it is a challenge with all of the different vaccines and new ones coming. So thank you.
So Mr. Chair, if I might just move into item C under the situational report having to do with the budget request. And I didn't know exactly what that was going to look like today as I was putting the agenda together, but as Amy has put pen to paper of, the extra staffing needs to pull off this vaccination effort, the numbers are quite large. And we have received through the Idaho Immunization Program, the Department of Health and Welfare, a sub-grant to assist in the efforts to the tune of about $49,000. We have been informed that there is additional funding coming to us through that route. In addition, as we administer these vaccines, we are billing insurance or Medicare for the administration fee. The vaccine itself is at no cost. But insurance companies are reimbursing for the administration fee of that. So just like every other vaccine or immunization that we do, we're billing an administration fee. If people don't have insurance, there is no out-of-pocket cost to them. So we just want people to understand that. And then one additional funding source is Governor Little had made available some grant funding to assist providers through this effort because, again, the workload and logistics are tremendous. To give some funding of $15 for the first shot and $25 for the second shot for providers that get those vaccinations done and actually entered into IRIS in the 3-day time period. And so we're enrolled in that program and we'll be receiving some of that funding. The staff time, obviously, for answering phones, for making the appointments, for all of the data entry, we've had to hire more staff to do that. And so As we just have a preliminary number right now, that's looking to be maybe $350,000. We know that much of that will be covered from these other revenue sources. And so I'm not coming today at this point to ask for any funding commitment. We will need to do a budget adjustment in March or April to account for all the increased revenue as well as the increased expenditures that were not included in this year's budget initially. So I just wanted to give that to you as awareness that along with the preparedness side of things, right? We got extra funding to help with the contact tracing. We're having to account for that in our budget, and we'll bring that to the board in the next meeting or two to look at all of that as a big picture and make some budget adjustments.
Okay.
And then just one, I guess, last thing that I had put on here that we do have, emergency reserve funds that in the event that we need to go into those, I would bring that request to the board. But just for you to be aware of the situation, and we will have much further detailed discussion in a coming board meeting. Okay,
sounds great.
And then one last thing on this, the situational awareness. I had intended to mention this at the start, but on Tuesday of this week, Governor Little did make an announcement that because of improving case rates and lower hospitalization, he moved the state to a stage 3 order. And that primarily changed the restriction that was on gatherings. It had been gatherings of no more than 10 people for, social events. It did not apply to political activities or religious gatherings. That has been increased to now allow gatherings of up to 50 people. There were some other specific exemptions in that in addition to those that were included originally, and that does have to do with healthcare clinics. And so, for example, the mass vaccination clinics that we're doing, those are exempt from the gathering limitation. Along with that, he did provide a opportunity for individuals, and give me just a minute to get back to our health district website to show you. He did allow for exemptions to be granted for people that wanted to have gatherings of over 50. And if people can find that form, it doesn't necessarily require public health approval, but it does require people to fill out this document. It's called a gathering plan attestation form. And it does require people that want to have that exemption to complete this form and really kind of have a plan in place of how they are going to maintain the physical distancing and other mitigation efforts that we know have been successful in slowing the spread of disease. And then they have to submit that to the health district where the event will take place. So I know I've had many inquiries already, but that form can be found right here on our website under the COVID information and news, and it's this link here. We've also linked to the governor's Stay Healthy order as well. One last change that was incorporated into the stage 3 order is that recently, high school and middle school sports were granted a different opportunity to have up to 40% capacity for those activities. That same opportunity has now been extended to other activities. So whether it's a dance class or parks and rec activities that aren't specifically associated with a school have that same ability to have those events. And so these protocols have been also posted here on our website that link back to those details from that order. Are there any questions about that? Okay.
Here, Annie.
You ready to move on to item 5?
Yes, please.
Okay. So as we've talked about the Eastern Auto COVID response plan, it does have a criteria for a county to increase in risk level based on the active case rates, as well as to decrease into a lower risk level. And I'm going to just go back here for just a moment to our dashboard. And this is what we're talking about right here. So we've had 3 counties that have been in the moderate risk level, and Custer County and Jefferson County have both at this point been under the active rate of 15 cases per 10,000 population for the 14 consecutive day period as outlined in our plan. And so those 2 counties would be eligible to move back to the minimal risk level. With that comes the lifting of the order, the public health order that our Eastern Island Public Health Board has in place that requires face coverings to be worn when people are in public and not able to physically distance. Bonneville County, I'm just going to click on, I want to just demonstrate this again because I don't know that everyone knows that this is accessible, but I'm going to just show you. So for Bonneville County specifically, if you choose the specific county you want to look at, I'm going to slice it down to just for January. And it shows the case counts and the active rate is this blue line. If you right click on the table, on the chart, you can show the data as a table. So again, this is for Bonneville County, and people can track the active rate for that particular county. Bonneville County has been under the 15 per 10,000 rate since Monday, January 25th. And so the 14-day period, assuming things stay below that rate, would be on February 8th. And at that time, they would be eligible to move back to the green or the minimal risk level and have the order of restriction lifted that requires the face coverings. And so those 3 counties, Mr. Chairman, I have drafted the order lifting those restrictions that are for the board's consideration today. Before you take action on that, I do just want to say and reiterate what we heard from our hospital partners, that just because we're moving in a positive direction, it doesn't mean that we are at the end of this pandemic. And if in fact the orders are lifted today, public health still recommends that people wear face coverings when you are not able to physical distance from others outside of your household. So with that being said, I will go back to the order, the draft orders, and turn it back to you, Mr. Chairman. Okay, and I appreciate what's said. Just because we do move back to the green, if that's the position we take, doesn't change the fact that all of those mitigation factors are still necessary. And it's actually in our plan to recommend those. You know, all of them are still recommended. Nothing really changes, and we can see the progress that has been made. And so we would hope that everybody continues that regardless of our action today. I heard go ahead, Jerry. Did you? Yeah, I'm sorry to interrupt. I wanted to just mention Madison County because I had also included Madison County on the maybe discussion today. Madison County also is moving in a very positive direction. And let me just pull that up quickly. You know, they're well on their way to moving into the moderate risk level. But I put that just for discussion simply because we don't have another board meeting scheduled until March 4. We can certainly wait, and it's hard to really predict what's going to happen over the next 30 days. We know that. And so I only wanted to call that to your attention that, you know, potentially Madison County could move to a lower risk level between now and our next board meeting. But I am not proposing today that we take any specific action on Madison County.
Okay,
So you
Of
can
course.
see that, sorry, you can see that they have been under the rate of 30 per 10,000 for many days. And in fact, I need to go count it up because they're getting very close to moving to the yellow, the moderate risk. So we will automatically make that transition from high risk to moderate risk. It's when it moves from moderate risk to minimal risk that the board needs to actually formally take action.
Right, that's correct. Yeah, so you can go ahead and move those on your own. So board, today then we do have Custer County and Jefferson County to consider, who have been under the rate now. For our plan, and Bonneville County, we're just 3 days away. I personally believe that it's important to follow our plan, to follow the numbers that we laid out. It has served us well. It has been a really good tool. It's taken away, any arbitrary decisions, and it's been true to us. We do allow for comments from the elected officials in a given county. If they feel strongly one way or another, we can consider that. But we're still free to, act independently on our own, what we see as best for Eastern Idaho Public Health as a whole. So I'll open it up for discussion. And as we're having the discussion, consider that we can certainly take a motion for those two counties. And I would recommend, following precedents that we've done before, that since we're not meeting for another month, that we consider also a motion to approve Bonneville County when they have reached that 14-day. So I'm going to go first to Commissioner Young from Jefferson County.
Yeah, thank you, Chairman Reed. I appreciate the opportunity to speak here. I too think it's important that we follow our plan. The last thing we want to do is try to show that we want to control people, and many of our constituents feel that way, but we really don't. We want to follow the science that the health board, Jerry, and her staff have been so vigilant and leading us through this. With that being said, I am a little bit concerned with the relaxation of the restriction of group size gathering, and I'm a little bit nervous about what the last 3 days the data has shown. But nonetheless, I think it's time to follow the plan, and I'd like to see the restriction removed, and that we go to a lower level.
Okay, thank you. Commissioner Butts was not able to be with us today from Custer County, but I know he would support following the plan and going ahead and lifting the restriction. Are there other thoughts from board members? Commissioner Mendenhall?
Yes, just a quick note. I really concur with your analysis. I think we should follow our plan. I think if we divert from our plan and say, well, we're close, that kind of takes some of the emphasis out of our plan. I know there will be those who will say, don't remove the mandates, don't do this and don't do that. If that's the case, let's revamp our plan. But I would like to, I'd like to stick with our plan and follow it the way we have laid it out, unless it proves adverse. And so far, I'm with you, Mr. Chairman. It has not proven adverse. In fact, we're going along. And if we have to go back and move a county back or move it up to a higher level, so be it. But I just wanted to plug in. I'd like to see us follow our plan to avoid confusion.
Okay, thank you. Other comments? Hearing none, I would be ready for a motion, and it could be in one motion, but the counties will have to be broke up to consider Bonneville separate. They need to complete to the 14 days. I know we have had some input of individuals that want to see the face coverings continue. And I respect that. And I hope they do. I've had school board members tell me that they will continue to encourage them in schools to help, because schools have been one place we've seen where they've really worked, right? I mean, as they've enforced them in the schools that they have, we've seen minimal transmission spread within the schools, during school days. Maybe happen at events and other places, but they've proven to be a really good tools to help schools control it. So with that said, I would consider a motion. It can either be in one or two.
Mr. Chairman, this is Commissioner Young. I'd like to make a motion that we move Jefferson County and Custer County into the green level of restrictions, and that we also move Bonneville County to those restrictions when they meet the criteria, if they meet the criteria after 14 days.
And Mr. Chairman, may I just add to that and formally rescind the orders of restriction?
Oh, yes.
Yes. So that would include that as the motion, correct? Is that okay, Commissioner Young?
Yes.
Yeah, yes.
This is
Okay.
Commissioner Shenton. I'll second that motion.
Okay, we have a motion and a second. Is there any discussion? Hearing none. All in favor, say aye.
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 Is there anyone opposed?
I'm opposed.
Okay, so Dr. Nelson votes in opposition. Did anybody abstain? Dr. Nelson, would you like to share your thoughts with us?
I don't believe we have enough of the population vaccinated and positive for cases and antibodies to achieve any level of herd immunity. And I'm concerned about the more virulent strains that are starting to circulate in the United States. I think we're set up for another surge. It's not the time now to reduce our vigilance.
Okay, thank you. I appreciate that. The motion does pass, but let me say how much I do appreciate your expertise and thoughts, Dr. Nelson. And it makes me, excuse me, it makes me extremely nervous as well, as we see what's going on around us in some other states and areas, as we see the different strains. It makes me extremely nervous, and I hope that everybody will keep the course and will continue to take all the precautions that we've learned now. We all know that they help, those things that help, and I hope they will. I had a farmer colleague stop at my place last week, and he was sharing with me his concern as well, that as we see the governor lifting gathering limits and the legislature working to remove certain precautions, as the public sees these numbers come down, hospitalizations come down, people may be inclined to drop their guard a little bit. And he was really concerned about that. He said, it's just like when we grow a crop of potatoes all summer long, and we've worked so hard to gain all the ground that we have and to have a good thing coming, and we're so near the end of the season, and then we don't give them the last irrigation. We stop one irrigation short. You completely ruin that potato crop for the entire season. You ruin everything that you have gained if you stop short. And he was concerned about that, and I am too, and I thought it was a great analogy. And so I think it's just so important for the public and everybody to understand the concern of Dr. Nelson and all of us. I know we all share it. And it is so important for everybody to now be as vigilant as they can on their own to do all those measures necessary, including face coverings. But everybody take it upon themselves now to continue that fight. We're close to this. we're just so close. If we can just get a few more weeks, a few more months, if we can just get enough vaccinated to where we get that immunity, as Dr. Nelson talked about, we're going to be there. But let's not go backwards. I thought it was interesting that James Corbett told me a few days ago how just in these short few weeks since we've had the vaccination, we've achieved nearly the same immunity through vaccination as we've achieved all year long with people contracting the virus, right, and getting some immunity naturally. And we've done that without people going to the hospital, without any deaths for that population. So we know this vaccination period is so important, and encourage everybody who can and feel comfortable with it to please do that, because that's how we're going to get to the end of this. And so thank you for all of you. Any other comments before we move on into the agenda?
Mr. Chair, Bill Lake.
Yes, please, Bill.
Thank you, Commissioner Reed. I just want to make clear to everyone that might be listening in that in Teton County, the leadership over here, the mayors, the county commissioners, don't assume that if and when we get below that lower threshold, that we're going to rescind, I'm going to support rescinding the order. We're going to need lots of understanding of what's really going on in our community before we back off. So we're staying full force as long as we have to. Thank you.
Hey, that's great. Thank you. And certainly each community or each city has that opportunity. And I know you guys have been very vigilant at it. We hope everybody will. There's no other discussion. We'll go ahead with our legislative update then. And we'll go back to you, Bill.
Thank you, Chairman Reed. And thanks, everybody. It's been a great discussion today, learning a lot. And again, appreciate all the efforts of Jerry and her staff to get this thing organized, to get these vaccines going. It's a monumental task. I'll be fairly quick, so if there's any questions, certainly people can ask. And I want to thank Jerry and Brian for going over to Boise last week with me. We made a trek over there, and I think it was extremely productive. It's very fortunate that we were there, and we also saw Commissioner Mendenhall from Madison County over there to work with our legislators to educate them on public health, what we do, why we're doing it, and how things work. You know, most of those legislators are not as involved or an understanding of what public health is all about. So we were fortunate that we were able to meet with the governor, the lieutenant governor, senior leadership over there in the health and welfare committees for the Senate and the House, and just a multitude of other representatives to help them and make sure they know that if they had any questions or concerns about public health, who they can contact to get those clarified. Our first meeting in the morning, we did meet with the chairman of the Senate Health and Welfare Committee and Senator Vick, who is working on a bill that's going to be introduced this afternoon at 3 o'clock to address overall the powers and authority of the boards of health. And we can't talk any more about that until they meet this afternoon and put out the draft bill that they're going to propose. So we all should be looking forward to that. Other things that have come up in the legislature is House Bill 33, which is a review of any health board actions by the appropriate board of county commissioners. So House Bill 33 And I think they're going to have to work on some language on this one, because I don't think the Board of County Commissioners really have the time to review all the actions that if somebody challenges that the health board does, that they could possibly keep up with it. Fortunately, we don't get that many, but when we do get them, they are very time consuming. So that'll be another one to watch. There's also House Bill 67 and 68. Those bills basically are going to show that the only authority to close schools is going to be with the school boards or with the governor, which, to be honest with you, I don't think our health board has any concerns with that, because that was never our intent to do that without working with all the appropriate people to begin with. So those bills are specifically going to say, and they're not just our public schools, but they apply to the universities too, that the Department of Health and Welfare, the District Board of Health, and the cities will not be able to close schools. House Bill 63 is one out there that's going to prohibit mandated or forced vaccinations. That one I don't know much about, but Jerry, if you want to expound on that one at some point, you're welcome to do that. So again, it's important that I think everybody know that as District 7 going all the way Motto Falls to Boise on a moment's notice is extremely important for the legislators, so that they get to talk to the people that are really involved in this. And even though some of the other health districts were unable to show up, they relied heavily on our efforts to be there. So again, I appreciate Brian, you getting over there. I know you're a busy guy with lots going on, so as is Jerry. So thank you. Yeah. That's all I have.
All right. Thank you, Bill. Appreciate that. Appreciate all the work that you're doing on the legislative side. We'll move next into our announcements, Jerry.
Yeah, I just have a few things to update you on. The first is that we have received the affirmative votes from the majority of the county commissioners for the appointments of Commissioner Madsen and Commissioner Dance to our Board of Health. So welcome officially to our board. I also want to report that public health districts will be presenting our fiscal year 2022 budget to the Legislative Joint Finance and Appropriations Committee on Monday, February 15th. That will actually be done by Zoom. And I will be actually the spokesperson for the 7 collective health districts for this year's presentation. Some sad news to report that Ken Estep, who was the board chairman for Southeastern Idaho Public Health in Pocatello and former Power County commissioner, passed away over the weekend. For those of you that knew him, he committed a lot of years to public health and supporting the efforts of public health in Idaho. And so just send our sincere sympathies to his family. And then just one last maybe a fun note. I just want to wish a very happy birthday to Mimi Taylor. It's her birthday today. And while Mimi, her picture doesn't show up on these board meetings, Mimi has been behind the scenes since day one. When we had even before we had our first cases, Mimi has been the one that interacts with the public on all of our social media. And she has had, I would say, one of the most difficult jobs throughout this entire pandemic. And I just can't tell her how much I appreciate the efforts that she puts forth 24/7. If you're commenting on Facebook, you can assure that she's going to be responding and providing education and answering questions and just doing everything she can to help educate the public. And I just want her to know how much I appreciate all her efforts in this throughout this last year, and to wish her a happy birthday. That's it, Mr. Chairman.
Well, thank you for that. I didn't know that. And happy birthday, Mimi, from all of us. I'm sure we do appreciate you very much for everything that you've done. along with everybody right there, as I've said. So thank you and happy birthday. I hope you get a little time to enjoy today. Are there other comments from board members before we close?
Mr. Chairman, I just have a question. Are we seeing much reactions from the shots at all?
We'll let Amy respond to that.
Yeah, we've had what kind of had been reported nationally as well. People reporting, sore arms, and then having some of that, kind of feeling under the weather for that 24 hours. We've had a few of, along, but I didn't turn my camera on. So very similar to what nationally is being reported as well, with some of the more severe, with our 7,000 doses. We haven't had anybody have, immediate severe reaction in clinic, even though we've been prepared if we see any anaphylaxis. So sore arms, 24 to 48 hours, feeling, maybe a fever, a headache. Those would be the most common that we've had reported to us.
Okay, thank you.
Yeah, thank you for that question. Any other questions before we close? Next meeting, Jerry?
I believe it is March 4th. March 4th.
Okay. And we'll just stay with this 7 a.m. schedule, I guess, until further notice. I hope we're only a few meetings away from being able to meet back together in person. So that's what we're all hoping for.
Mr. Chairman, may I?
Go ahead.
I'd like to see us be on a little bit of a standby if we need to call an emergency meeting, if legislation indeed does turn to where we need to have some input or discussion of the board, if some of the legislation, I don't know.
Okay. No, we appreciate that. And we always are, if need be, I'm sure that this board would be willing. We've been that way. Each of you have been so flexible to be able to meet as needed all year long. And so we will keep that in mind, Commissioner Mendenhall. If need be, we can always pull a meeting together, a special meeting with just a 24-hour notice.
Mr. Chairman, may I just make another comment?
Yes.
Every Friday, the executive committee of the Idaho Association of District Boards of Health, of which Bill is our representative as our trustee, they're meeting weekly at 10 a.m. Obviously, a large focus of those meetings is on legislative activity, and our hired representative, Mike Kane, gives the trustees an update on the activity. So that's something that is it's a public meeting. People can view that and be updated weekly as well. But yes, I appreciate that, Commissioner Mendenhall, and appreciate the board's willingness to be called together as needed to address emerging issues.
Okay, thank you. Well, I again encourage everyone in the community to be as safe and vigilant as possible. I think we are on just a bit of a line here to where we can just continue to do all that we can and keep our community safe as we build the immunity needed to where we really are safe and in a little better place. So I'm so grateful that we're where we are, that the numbers have continued to come down. Just most grateful that we're not seeing those daily reports of death in our community, although there still is the risk to many that are in the hospital. There's still many seriously ill, and I appreciated what Dr. Gonzalez said earlier, and of course what Dr. Nelson said. So my parting encouragement would be, please, to everybody, just continue to do all that we've been doing and to keep us going in the right direction, and to make our last irrigation right, to finish this year out in the right way. So thank you, everyone. We'll go ahead and close this meeting.